Welcome to Among the Lilies. This is a show for ladies who are tired of pretending and are ready to be real. I'm your host, Cameron Frad, and in today's episode, I interview Dr. Teresa Hilgers. Okay, ladies, I gotta tell you, I am so happy that this OBGYN, this doctor, she is both sweet and brilliant, and she is so passionate about women's health care, and I'm just really excited for this interview. You guys are gonna love it. It's a bit long, but I was just so thankful to have the time with her to talk about things like women's health and endometriosis, PCOS. I get asked from women from all over the world about this, and I'm so excited to actually interview an expert on it. So you guys need to not only listen to this, but share it with all the women you know. Whatever Facebook group you're part of or Instagram, whatever, share it on social media. All women need to know the way their body works. And she even gets into IVF and how it's actually not as helpful as people think it can be for people achieving pregnancy. She's looking at the overall whole person of the woman and her health, and it's just amazing and beautiful, and obviously is upholding to church teachings, and it's just a great interview. So listen when you get a chance and share it with all the women that you know. I just want to say thank you so much for all of our patrons who make this episode, make this show happen, and we answer a lot of their questions in this episode. So if you have more questions, I'm going to actually have Dr. Hilgers on another episode again soon. And if you have specific questions you want answered, go to patreon.com/amongthelilies, and you can ask your questions there that I will then ask her in return. So without further ado, enjoy this episode.
G'day ladies, Matt here. I'm currently editing this podcast, and I wanted to share with you the prayer that Cameron prayed before the interview began. Usually she wouldn't share this, I always edited it out, but I just think my wife's absolutely amazing, beautiful woman, prayerful woman, and I wanted you to experience it. So don't tell her I kept it in.
We've been praying for this. It's going to be great. I'll go ahead and open us in prayer, and then we'll just dive in. Does that sound good?
Sounds perfect.
Okay. Father, Son, Holy Spirit. Amen. Heavenly Father, I thank you so much. I thank you so much for your goodness, Lord. I thank you for Dr. Hilgers and just this time that she has to speak with me, and for all of our listeners, ladies, all of our lady listeners. Lord God, you know how confused we are about our bodies. You know the day in which we live, and just we're getting mixed messages all over the place. I pray that you bless and ordain this conversation that we're about to have. Give us your wisdom. I pray that you speak through Dr. Hilgers and myself, and that you just speak truth and love, but you just remove any and all confusion in our listeners' hearts, in their minds. Just remove confusion and give them peace and wisdom to know what is true, good, and beautiful. And Our Lady, we ask for your prayers and intercessions. Amen.
Amen.
Father, Son, Holy Spirit. Amen. So, Dr. Teresa Hilgers, thank you so much for coming on the show today.
Yeah, it's great to be here. I really appreciate it. Hopefully we'll have a good conversation.
Yeah. Why don't you go ahead and introduce yourself to our listeners?
Yeah, so my name's Teresa Hilgers. I'm a OBGYN in Omaha, Nebraska. I work at the St. Paul VI Institute. I graduated from medical school at Creighton University here locally, and did my residency in obstetrics and gynecology in St. Louis, and then came back to Omaha in 2016. So I've been here for a few years, and practicing medicine that takes care of women, but respects the Catholic faith as well.
Yeah, and your whole family's kind of into it, right?
A little bit, yeah, a little bit. My father's an OBGYN. My parents helped co-develop Creighton models, so I kind of grew up with it. I didn't want to be a doctor. I did not want to be like my dad. And every day I'm like, shoot, I'm more and more like him.
Right.
Every day.
But only in the good ways. I'm sure you're way prettier than him. I mean, you got to
I don't know about that. But no, he just worked so hard. And, there's challenges being a Catholic OBGYN.
Oh,
and,
I know.
So I saw that growing up, and I kind of just wanted to be a mom and, take the, and so I didn't really see how medicine could work with that growing up, but God has different plans for us oftentimes than what we think.
Yeah.
So I changed and became a doctor. So,
nice. And you have a brother
yeah.
too. I saw your brother in Houston.
Yes. So I have my brother is an OB/GYN in Houston. He's been in Texas for some time now, but so he's also a physician.
And do you have children? Are you married?
No, I'm not married. I don't have children. See how God works.
I know.
So we take different paths than we realize, but that's okay.
He calls us all, but I'm sure you have more babies than all the rest of us if you count every baby you've ever delivered and cared for.
Oh yeah, I don't know about that, but all these babies are so precious and just beautiful gifts. So it's really wonderful.
Yeah. So I was diagnosed with stage 4 endometriosis when I was 19. I had a laparoscopy and I was told I had stage 4 endometriosis. And it was actually my boyfriend at the time who diagnosed me because his mom was a Creighton instructor.
Really?
She was a Creighton instructor. And he's like, you realize you have probably endometriosis and PCOS. I'm like, what are you talking about? And I was so surprised. He's like, you're always sick when you're ovulating and on your period. And I was so offended. I'm like, how did you even know? Like we had a very chaste relationship. And anyhow, fast forward. I've been so blessed by Creighton. I have 4 children here on earth and it is only because of Creighton. I lived in Ireland. So Dr. Phil Boyle, I had out there. And so I was on low-dose naltrexone in between pregnancies, and I've had 4 C-sections, 3 laparoscopies, and unfortunately ended up with a hysterectomy about a year and a half ago, which was so sad. But the doctor who did my surgery said, I don't know how you carried a baby to term. My womb was apparently so inhospitable. He's like, I don't understand how you carried one. And I really think it is the blessing of NAPRO technology that I was able to have children. Could you just explain what NAPRO technology is for us?
Yeah. I think the best way to describe NAPRO technology, it's a form of a woman's health science that basically looks at evaluating and diagnosing the underlying causes of female reproductive issues and then correcting them in such a way that is actually cooperative with the woman's cycle, that doesn't suppress the cycle, that doesn't damage, her reproductive system. And so in a lot of ways, we want to basically figure out what's going on and then correct it. And that's kind of the general an easy way to look at it, but we actually deal with so many different things. Endometriosis is one of the big battles we face. But there's a lot of other abnormalities, hormonal abnormalities, ovulation issues, infertility, premenstrual syndrome. All of those start to play a role. And when you start to understand the reproductive system, you can see how they all play a role together. Once one part of the system is affected, a lot of times it snowballs into the other areas. So, for example, women with endometriosis, and I don't know if a lot of people know what endometriosis is, but it's essentially when a woman menstruates, she sloughs off the lining of her uterus, and that lining is only meant to be in the uterus. So when tissue that looks like that gets outside of the uterus, that's called endometriosis, and it's very inflammatory and all that. And so what we find in women with endometriosis, they have pain, infertility, miscarriage, but they also have hormonal abnormalities, ovulation abnormalities. So there's a lot of things that spring off of that disease. And so it can be difficult to treat. And so our job is to figure out all that's going on and then try to help these women feel better, is our ultimate goal. Figure out what's causing the problem, treating it, and helping them feel better.
Yeah, and getting them functioning again. I know for me, I would be so sick. Like I could barely leave the bathroom, let alone leave my house during ovulation and my period. And it was just, and I have PCOS as well. But and you think, like, I remember people telling me, like, I had a very high pain tolerance, and people are like, this is ridiculous. Really? Like, some cramps are keeping you in bed? And I'm like, yeah, these weird cramps are making me vomit and have diarrhea at the same time. And like, it makes my whole core want to be on, like, all my insides want to be on my outsides. Like, this is way more than some little cramps, right?
Exactly. Well, and I think this is a problem. I think women talk to each other about their cycles, right? And so what happens is women will look at their friend and be like, well, my cramps aren't as bad as hers. And so therefore I'm normal or I'm okay. When in fact, they're actually not normal. And I find this a lot whenever I meet a new patient. I'm talking a lot of times, well, what are your periods like? How painful are they? Do you use ibuprofen? Can you function without ibuprofen, for example? And it's amazing how many times women will tell me, I just thought this was normal, or my cramps have always been this way. What are you telling me? This is not normal. And I think a lot of the times women tend to compare themselves to other women. And so if if they perceive their cramps not as bad as those around them, then they're going to consider it normal. Or I've had women who have been told by, family members, physicians, friends, oh, no, your cramps are fine. They're meant to be painful. And so what happens is these women go years without understanding that, no, this is not normal. And the more and more I do this, I think we actually have a very poor understanding how much pain a woman should be experiencing. I'm actually of the opinion now that women should experience very little pain with their periods, with none to very mild cramping. If you have to have ibuprofen, maybe once during your period or twice, that's okay. But if you're living off ibuprofen and you can't function, if you miss a dose or if you're a little late, that's not normal. And I think a lot of people think it is normal. You just take the ibuprofen, the Tylenol, the Midol, whatever.
Well, I think that's what we've been told too, right? Because I remember my mom taking me to a OB when I was still in high school. It was I think I was 12 or 13, but my periods were just so painful. And the doctor was like, make sure you always have Midol on you and make sure you're taking it. And we probably need to put you on the pill. And they put me on the pill when I was crazy young, and I was always on it. And I remember hearing that it's like a class 1 carcinogen. And I'm like, oh, wait, I don't want to be taking this. Like never mind the abortifacient and all the other but at the time I was a kid and I wasn't in any sexually active relationships, but just it being so bad for my body.
Yeah.
It's like,
well, why would the problem?
Go ahead.
Yeah, sorry. No, I mean, that's the problem. I mean, I think, it's interesting because endometriosis can be found in teenagers who are very young. Some of the worst cases of endo I have seen have been in young teenage women. So sometimes we're thinking, oh, you're just young. You don't know how to deal with the cramps, things like that. It's nothing. Some of our patients are told that you just need to suck it up. And it's part of being a woman. Like I know somebody who's been told that by a medical professional. And so, I think we tend not to believe these teenagers when they're in pain. And so then, the problem is people look at birth control as a treatment for endometriosis or painful periods. Well, it just manages the symptoms. It's actually not a treatment.
Right. And no, it's only a Band-Aid. It's not getting at anything underlying.
Correct. And I view endometriosis as a surgical disease because the only way you can truly diagnose it is with surgery. And the only way you can adequately take care of it is surgically. So in my mind, medical management, I am a believer that if ibuprofen is not managing your pain, if you have to go beyond that, then you've failed medical management. And, I think that's when you consider surgery. Now, there's certain times and place. It's not that, oh, you've had one bad cycle, I'm going to just take you to the operating room. But I think we have to be more aware of what this disease does, so that we can adequately take care of people and get on top of it when these women are young, so that they don't have to deal with infertility down the road, or we can protect their reproductive organs for that time when maybe they want to become pregnant, when they're in their 20s or 30s. Because a lot of times our patients who come to us with infertility, infertility is highly associated with endometriosis. We did a study and 77% of these women with infertility had endometriosis. But what happens is they've been on the birth control pill for years because they were told this will manage your pain. And then by the time you start to evaluate them for their infertility, they might have significant disease, or maybe it's been there the whole time. It's always affected their lives. But imagine if we could have gotten on top of this 10 years before.
Yeah.
And what we could have done for not only their fertility, but their quality of life. Maybe they wouldn't have to be on the birth control pill, and there are side effects to that we do need to worry about. So I think these are all the things that it's kind of a mindset, and we have to change it. We have to get on top of it at an early age. And a lot of it comes from education and awareness of what our bodies are designed to do and how they should function. And so that's something that is going to take time to do, because it's going to be a lot of education, I think.
Well, and I think that we also need to get past the lies that we've been fed. So as you said, Dr. Hilgers, I would love for you to talk to any listeners that are listening and maybe are not religious at all. They don't have any religious conviction, and they eat organically. They, shop at local farmers markets, and yet maybe they have an IUD, or they're on the pill. Like, I think there's a disconnect, and it's like, oh wait, this thing that I put in my body every day, or this thing that I've had surgically implanted into me is not good for my woman's health, because we've been lied to from the industry. So could you speak to that person just from like a natural point of view?
Yeah, I mean, we actually have a lot of patients who come to us who aren't necessarily, we have a high population of Catholic patients who, stay faithful to teaching of the church, don't want to be on contraception or anything for that. But we also have patients who come to us because they are having medical issues, whether it's painful periods, significant premenstrual syndrome, and all that. And I think the important thing is, as women, we actually need to understand how our bodies work. And so when you're put on the birth control pill or given IUD, most of the time people aren't explaining to you how it actually works and why they're giving it to you. These things were actually originally designed for birth control purposes only. And then, they tried to find ways to make them medically relevant as well. But their number one goal is actually to be contraceptive in nature. So if we always remember what the number one goal of that medicine is, I think it helps us understand then where we need to go with it. So a lot of the problems they aim to treat with it were not the original design of that medicine. Now, in medicine, we use all the time medications that maybe that wasn't the original purpose of it, but we found there's a great benefit to it. But the problem is, when we use birth control for a lot of these medical issues, it's actually a subpar treatment. And so I think that's the big thing. We kind of view hormonal contraception as the number one treatment for everything. In obstetrics and gynecology, it's one of the few fields where we basically have one type of medication that we give for every gynecological issue.
Right. No other field does that happen. You go to the doctor and like, here's the pill. We're not even going to label them because we only have one treatment plan.
That's correct. And, and the other thing is, I'm often amazed at when women get put on different types of hormonal contraception. There's a wide range of them, and they do have different modalities, different, concentrations of medicines or artificial hormones in this one compared to that one. So they're a little different, but they tend to all work the same way. And that's basically, they suppress ovulation, they thin the endometrial lining, and they thicken cervical mucus. That's kind of their hormonal management. But we have a lot of women who get put on them for pain, premenstrual syndrome, all of that. Now, when we operate on these women, if they've been on the birth control pill and they stop it, we operate on it 60 days later. On these patients, we have to have them off 60 days after they stop birth control. And the reason why is because there's always this theory in medicine that hormonal contraception actually suppresses endometriosis. Well, when we operate on these women 2 months later, they have endometriosis. And you can't tell me that the birth control pill actually suppressed really anything, maybe a very small lesion here or there, but it didn't get rid of their endometriosis, because there's no way in 2 months that endometriosis appeared after they stopped hormonal contraception. And so I think the great tragedy is we're giving these pills or these IUDs or these implants, and women aren't explaining how they work or anything like that. But the saddest part of all this is women don't know how their body's supposed to work. And when I see new patients, I've been told this time and time again, I didn't know my body worked this way. When they start charting their cycles, they're amazed. They're like, I had no idea this is what my body was supposed to do. And when you explain to them how their body's supposed to work, then you can identify the areas where things are off. And this is why you feel this way. You have pain because of this. You have PMS because you have an inappropriate production of hormones. And let's actually evaluate it, get the correct diagnosis, and then treat it. And most of the time, you can have patients feel so much better. There are some more difficult cases where it might take a lot more, but I think if we just evaluated these women correctly and actually educated them on their bodies and how things would work, I think you'd have a lot more women not using hormonal contraception. And there are side effects to it. I mean, I have a lot of patients who come to me who just don't want to be on it anymore. They don't like how they feel. A lot of times they tell you it didn't work anyway, and so I think as medical professionals, we have a lot to do, and I sometimes think we sell our patients short.
Yeah. And I think that women's health in particular, I was talking, I did an episode when we were talking about the bill getting passed in Ireland, and I had 2 babies in Ireland, and my medical care was actually good. It was all, government, whatever. It was all done through the government.
Yeah.
But my midwives were great, and they visited me in my house afterwards to make sure I was okay and my baby. And I'm like, you're going to lose that. Like once your industry is now split, like I think, and I'm like, learn from us in the States, like the money making industry of abortion and, contraception and stuff that gets all the focus. And like women's health is so, like it's just, it's subpar to say the least.
Yeah. And it's really sad. I mean, I work with the menstrual cycle every day. I come to work and I'm either talking to people about it. To explain how their bodies work, get them to start charting, or women are sending their charts to me all the time. We're working on medical problems. And I'm constantly amazed at what their charts show. And I don't know how many times during the week I think of new questions we don't know the answer to. And I'm like, gosh, dang it. We are so far behind. And part of that is because of contraception, abortion, IVF, and all those things. Because what are people doing? They actually skip the evaluation diagnosis part of the problem, and they just skip to a treatment. And it's kind of one treatment. There's different forms of, for example, hormonal contraception. If this birth control pill doesn't work, I'm going to switch you to this birth control pill. Right. If that doesn't work, I'm going to switch you to this one. Well, they're all kind of the same, but they skip the evaluation diagnosis part. And so what happens there is that we actually lose the idea of you actually need to treat what's going on. And when you lose that initial evaluation diagnosis part, you're going to lose opportunity to understand what the body's supposed to do and research it so you can develop better treatments.
Yeah, I think it's similar to someone goes to their doctor and they're like, and they test, they're like, oh, you're low on iron, and it's like, yeah, I'm just going to keep giving you iron pills, and they keep being low, and it's like, oh, your white blood cells are down too, and it's like, oh yeah, I have this gash in my foot. Have you not noticed? And they're like bleeding all over the place. I'm like, we're not gonna give you stitches. We're just gonna keep giving you stuff to help keep your blood up and your iron up. It's like, hello, like look at the gaping wound that needs to be attended to. Yeah, no.
Yeah.
Go ahead.
Go ahead. No. I could talk all day long. So
no. It's great. And you're the expert. So you're who I really want to hear from. I've gotten very upset in this industry, but I'm so thankful for you and what you guys are doing out there. I had a friend here actually that lives in Georgia, and she was trying to figure out what was wrong with her. And I was like, you know what? You could probably fly to Omaha. And she actually flew there, saw you guys, you did her surgery, and it was amazing. And she didn't end up paying any more money because you were in network, even though you're out of state, Yeah. And it's just like, you can get really good care. Yeah.
You sometimes just have to look for it. And, a lot of our patients come from out of state, actually. We have a large amount of our patients actually don't live in Nebraska. So we're in Omaha, Nebraska, around the border of Iowa. So of course we get Iowa patients, but we have them from all over, just about every state. I think we've had somebody from every state in the U.S. come to us. We are actually in network with a lot more people than I think they realize. But the other thing we're doing is we're trying to train young physicians to do what we do. And so, for example, I did a fellowship program through the Institute, a medical and surgical in medical and surgical nanotechnology. It was a year program, and basically that year was done after I completed my 4 years of OB/GYN residency, which you have to do after medical school. And what we learned there is how to correctly diagnose endometriosis, diagnose pelvic adhesions, diagnose polycystic ovaries, diagnose hormonal abnormalities, and then how to properly treat them. And it's a year program. And then, these young physicians then can go out into their communities are going to move to and replicate what we're doing here. So I think there have been about 27 I want to say it's been about 27 physicians who have done that. So they're starting to grow throughout the country. It takes time to do this, but our hope is that we can continue to grow this base of physicians who can provide these services,
Yes,
who are
and just
properly trained and all that.
yeah, and educating them. We had a doctor,
Right.
I think he went through some program. I don't know if it was that. He was an older doctor from Texas. Our my Creighton practitioner in Texas, it was the third person that she sent to him saying that there's signs that she had
Right.
I think it was cervical cancer, and
Yeah.
the doctor, and it was before she tested positive. So like the first girl, she's like, you don't have that. I don't know what crazy woman's telling you. Got her tested. It came back negative, whatever, goes back again. It's like, I really think you should test me again. He's like, I'm not testing. This is ridiculous. I'll test you again. And then it came back positive. And then this was a third lady it was about to happen to. And the lady's like, give me this woman's name. Who is she and how is she diagnosing my patients? And so he dove into naprotechnology and figuring out everything from that. But charting is so important for everyone, not just those of us trying to get pregnant. Could you share just some of the benefits, some of the things that you can see just from, and explain charting, like the cervical mucus, what we're doing here?
Yeah. So I think, when I explain charting to my patients, I actually talk to them first how the body works. And so, every month our body is actually trying to get pregnant every cycle. And even if we're not married or not married, that's our body's goal. That may not be our personal goal at the time, right? So there's changes in the hormonal system to bring about the ovulation and the potential to conceive a child, because that's the goal of the reproductive system. So what charting with Creighton model means is that women tend to have a very characteristic cervical discharge around the time of ovulation. And so we train women, we teach them how to basically make correct observations of the cervical discharge and how to record it on a chart. And it takes a little bit of learning, but it doesn't take long. And women, can get pretty proficient in how to chart their cycles. So what does this do for us? Well, every time a woman charts her cycles, I get a ton of information from that chart. I get information from how her periods look, how long they are. Does she have brown bleeding at the end of her cycles? Does she have a lot of spotting leading up to her periods? I get information on how long her cycles are. I can see if there's an issue with her mucus pattern, and I can see if after ovulation. So after ovulation, women have a very stable part of their cycle. It's called the luteal phase. And Creighton, we call it the post-peak phase, but that's supposed to be very stable in a woman's cycle. And when you start to see wide variations in that part of the cycle, there's a hormonal issue. And those women, for example, are at high risk for infertility and miscarriage down the road. So we think about it a lot of times for women who are infertile and need evaluation, but this is for any woman, whether she's single, married, because I think every woman deserves a chance to understand what her cycle looks like. And on top of that, it can be used to manage gynecologic problems. And so I often encourage my young teenagers, college students to start charting, especially if they're having problems, because they learn so much about their body, and it's going to prepare them to take care of themselves, to respect their bodies. And then eventually, some of these women are going to get married and want to have babies, and it's going to prepare them, and they're going to be ahead of the game than those women who aren't when they do get married and want to have babies. And so it's actually a beautiful tool. I have some women who learn how to chart after, they've had 4 or 5 kids, so they're in their 40s and they've got medical problems. So we get them charting, to kind of help them figure that out. So, I think sometimes people think it's only meant to achieve a pregnancy. It's not. Women use it effectively to manage gynecological problems, and then couples use it to either avoid or achieve a pregnancy. And so it can be used in all 3 phases of the reproductive years for a woman. So it's not like birth control, you have to stop it. When you want to get pregnant, you have to go back on it. When you don't, or you have to be on it for these problems. No, like you can evaluate your cycles this whole time. You can make changes to the medical treatment as the cycles change. You can use it to avoid or achieve a pregnancy. And I think one of the beautiful things is that when women learn how to chart their cycles, they meet with a teacher or a practitioner. And so much of that is not just learning how to chart, but I think learning how to respect themselves as a woman, as a couple, their marriage. We talk about things like spice, where we really get into the kind of spiritual, physical, and emotional aspects of relationships. There's so much that goes into it because we are not just our bodies, right? We are
Right.
women with souls and minds and hearts. And our body tells us a lot about that. But there's so much more to us. And sometimes I think we just get this concept, oh, it's my body, it's separate from who I am.
Right. And it just does this random stuff. I don't know what it
Right.
is. When you're charting,
Exactly.
it shows you actually there's a method to the madness. Like my body knows what it's doing. And you, as you said, you can spot if something's not right and
Right.
figure out how to fix it and to actually show
Right.
someone. Yeah, I had tons of stomach issues and gut issues. And I wish that I had actually gone to y'all's center like back in the day
Yeah.
when I was much younger, because I would have
Yeah.
loved to have seen like, okay, is it really my stomach issue stuff or is it the PCOS and the endometriosis,
Right.
And then also you brought up perimenopausal menopause. So women that I have some patrons that have asked questions, and one of them struggles with, I can't remember if it was PCOS or endometriosis, but she's now going through that stage in her life where she's going through menopause. How can charting be helpful? Are there other supplements that she could be using? On the other.
Yeah, I think it kind of depends probably exactly where she is. If she's menopause is basically the cessation of periods for about 1 year. And a lot of times there can be hormonal side effects of that, mood swings, hot flashes, and all that. But you can be perimenopausal for years leading up to it. And you can definitely utilize charting to kind of help monitor those cycles, maybe help manage those side effects associated with the changes in hormones. Maybe they need hormonal treatment, things like that. And again, in such a way that we wouldn't suppress the cycle, but kind of help support it and minimize those side effects. And then that woman is going to recognize, when she does enter menopause. So we can definitely utilize it in women who are perimenopausal. And so it kind of depends on each person a little bit. And I think that's a beautiful thing about it. It's a standardized form of charting, but each woman is a little different, right? And so she has a story with that, and that chart standardizes it so that we can correctly evaluate and diagnose her and then treat her. It's a great tool, but each woman's a little different. So we have to take her in, what she's gone through in the past, her history and all of that. But it can be used in the perimenopausal woman, certainly.
Okay. And then and then with progesterone and the progesterone, I know different people need progesterone at different levels. Why is that lacking in some of us?
Yeah, well, that's $1 million question.
I know, it really is. Sorry.
So women, for example, who have endometriosis tend to have hormonal abnormalities as well. So why is that? Okay, so we think that hormonal abnormalities are probably a cause of chronic stress, and endometriosis is a chronic stressor on the body. And so these women are probably undergoing these hormonal changes because of the chronic stress. And so the way progesterone is made, so once a woman ovulates, the follicle that had the egg will release that egg during ovulation. Once she ovulates, that follicle doesn't have the egg anymore, but now it turns into a different apparatus. It transforms itself into what we call the corpus luteum. And that now produces progesterone and estrogen. And if a woman becomes pregnant, that corpus luteum is going to continue to produce those hormones so that it can maintain a pregnancy. But if the woman doesn't become pregnant, the body recognizes that those hormones then are going to drop off naturally, and then she'll have a period. So that's how it signals to itself to have a period. So women with hormonal abnormalities don't have appropriate progesterone and possibly estrogen production. We'll see both abnormalities. And a lot of times that means they're very low during that whole part of their cycle where they should have progesterone, or maybe they start off somewhat normal, but they drop off prematurely. And we see these things. And what does that mean? These women, there are 3 things that we associate with this: significant premenstrual syndrome, which is a host of symptoms they can have starting 4 days before their period starts. So it could be irritability, bloating, carb cravings. They love their sugar, their sweet, their chocolate, crying easily. And I'll tell you what, that's me. I cry so easily. I have PMS, so I totally get this. if you say hello to me at the wrong time, my cycle, I could just start crying. And it's not because you're mean or nice. It's just, it just meant something to me.
Right.
I just start crying. It's not very professional, and anyway, so we see PMS in these women. We see higher rates of miscarriage and infertility in these women because they don't have the correct hormonal production, and they can't maintain a pregnancy because their body is struggling to produce the hormones. Mm-hmm. So it's struggling to produce it before they get pregnant. So when they become pregnant, it can't kick into gear like it needs to. And so it's still suboptimal hormones. And this is one of the causes of miscarriage and infertility. It's not the only cause, but it is a big cause. And we do see it a lot in women who have endometriosis, polycystic ovaries, these things, because there's already an abnormality within the reproductive cycle and it compounds itself, if that makes sense.
Yeah, I find it, I wish that I knew more than I did. I feel like I mainly only know from my own experience. But I always have people asking me questions just because I think I'm open about what's gone on. But yeah. I'm so surprised at how many women have so many issues. Like, do you think that we have more issues today because of things in our environment? Or do you think science is just now kind of realizing and getting caught up? Or is it because we've been taking all these artificial things? Why do you think?
Well, yeah. If you talk to the people who have been teaching crate model for a long time, 20, 30 years, they will tell you they think women's charts have become more complicated. And it's really interesting because they're like in the 80s, they weren't as bad as they were now. So I think it's twofold. I think this world, there's a lot more stress in this world than there was 30, 40 years ago. I also think that because of NAPRO technology, where we can start really using charting to diagnose and treat these things, women who are coming to us with problems are then charting. And so we see their problems basically displayed to us on their chart. Right. And so I think it's a combination of two things. When this first started, it was a form of kind of NFP at the time. And so it was really meant to avoid or achieve a pregnancy. And so, it wasn't meant as a medical treatment at that time. But over time, they started to realize, because it's a standardized form of charting, that these women with the same problems were having same things pop up on their chart. Mm-hmm. And so all of a sudden, it was like the light bulb went off and wow, this is actually telling us what's going on with these women. And so we were able to transform it then into a medical tool as well. And so I think since the advent of that part of it, so many of these women with medical problems are now charting too. And so I think it's a combination. I think it's a new awareness of what the chart tells us, but I also do think we live in a crazier world than we did many years ago. Everything is high stress now. Everything is instant, social media, our jobs, our pressures, all those things. And so I think there's a lot going on. It could be environment, it could be diet. It's hard to pinpoint one thing, but we do live in a more stressful world than we used to. And I think we're seeing it in charts.
Right. No, that's interesting. Okay. And then as far as, I would love to know. So I'd love to, I have patrons with questions, but I'm like, I want to get to their stuff, but I also want to talk about my stuff. So I'm just curious. So I had, as I said, I had 4 C-sections, and then I had a miscarriage that ended up with a septic infection. I had to have a DNC and then ended up with a septic infection from it, and lots of complications from that. And then was like crazy sick for like a whole year. I was told I had to have a hysterectomy. Mm-hmm. I tried going to a few different people, and everyone was kind of saying, same thing. And and I went for like my pre-op stuff, and turned out that I was actually miscarrying at that moment and didn't know it. And and then I ended up switching doctors. That doctor was basically like, I can't help you. So I ended up with this endometriosis specialist here in Atlanta, and we had no Creighton doctors or NAPRO doctors at the time. And so I had my hysterectomy, and I was so sick, and I was kind of told, once I have this, like, all my health problems will go away. And so he was able to leave. So he had like a limit of how many cysts would be okay. And it had to be like under 10 on each ovary or something. Okay. And I like just made the limit. Like one had 9 and the other was like 8 or something. So he drained all the cysts, but did a took out the cervix, uterus,
Yeah.
everything, got all the endometriosis. And I feel like I kind of got better, but now I'm in this weird thing where I'm still having health issues. My body's still going through. Could it still possibly be woman related, or no, because I don't have a uterus?
No, it still could be. So, one of the things, for example, with endometriosis is people think definitive treatment for those women who are kind of refractory to medicine, surgery, all that is hysterectomy. And typically in young women, they leave the ovaries behind and they just take the uterus, cervix, all that. Well, the one problem is, for example, if endometriosis is located outside the uterus and the cervix, they have to treat that as well. And so I have had patients come to me, they've had a hysterectomy, they're still having pain or abnormalities, things like that. And you operate on them and you find endometriosis. And so that still has to be corrected because they're still getting hormones from the ovaries, which feeds or stimulates the endometriosis. Or these women have their ovaries removed and they're put on hormonal replacement therapy to protect their bones. And they still have pain because it kind of stimulates endometriosis there too. So that could still be an issue. The other issue too is scarring. So scar tissue is one of the main things we worry about when we operate. So when I operate, I think of two things. One, I have to figure out what is going on so I can correctly treat the disease. So let's say it's endometriosis. My job is to see all that I can and get 100% of what I can see. My next concern then is what kind of scar tissue is this woman going to develop? Because the problem with scar tissue, so scar tissue is basically an abnormal connection between two things that shouldn't normally be connected. So for example, the ovaries move around pretty freely. And if they get scarred somewhere they shouldn't be, that's going to cause pain with ovulation because as that ovary develops with that cyst that's supposed to develop with the follicle, it's going to push against that scarring and cause pain. So women can pain around ovulation, things like that. So one of the things that we've developed here is how to reduce scar tissue. And that's something that we do very differently from other people. So after surgery, women still have problems because they still actually have endometriosis that wasn't adequately treated. They can have scar tissue, which can cause pain, mostly pain. If it was somebody trying to become pregnant, it can also contribute to infertility if it negatively impacts the ovaries or the fallopian tubes. And then the other thing, too, is like women who've had hysterectomies, if they had issues with like premenstrual syndrome or polycystic ovaries or things like that, those ovaries aren't necessarily going to start working correctly once their uterus and cervix is still out. So they could still have hormonal abnormalities, which is contributing to how they feel and things like that. So there's multiple things we still worry about in women who've had hysterectomies. Absolutely. So sometimes we think a hysterectomy will take care of everything. There are definitely women who need hysterectomies. We do hysterectomies, but you have to consider all these other things too. And we do also have women who've come to us because they've had hysterectomies and are still having issues. And a lot of times we can find these are probably the three other things that are still problematic. And then if it's not that, then we have to figure out what it is. So yes, I don't know if that completely...
No, that's good. That helps
tied
a bit
into what you were trying to get at. But yeah.
Hindsight, I was like, I wish I had just flown over there. I don't know why I didn't, but that's okay. That's my own.
Yeah, no worries.
But I went to like this endometriosis specialist and he actually said it was a really good thing I didn't have the laparoscopy procedure that I had with another doctor because he said my bladder and uterus were adhered to my C-section scar.
Yeah.
Like they were just all together. He's like, he would have gone right through. And I was like, oh, well, that's great that you didn't. Yeah. So yay.
Yeah, no, that's great. No, and that's one thing you worry about with C-sections is scarring. So we even try to like reduce scarring around the time of a C-section if we can too, because scarring creates so many problems. It creates problems with future surgery, and increases the risk with that too. So one of the battles we face is actually scar tissue, and those are some of the things we worry about with women who've had multiple C-sections like you. Absolutely.
Yeah. Okay. Interesting. And then I also had a patron that asked, he's in biomedical science and he's asking for literature or something for him to have conversations about, the secular arguments against the pill, abortion, contraception. Do you have a website or certain documents that you would recommend?
Yeah. Well, it probably depends exactly what they're looking at. We do have a website, St. Pope Paul VI.com, and that's VI because it's after Pope Paul VI now, St. Paul VI, so it's Roman numeral 6. And there's information there. We actually published a large medical textbook in 2004 with a bunch of our research. And that within that, you can see the effectiveness of our treatments. You can see our protocols for our treatments. We've, in 2000, great. I'm not going to remember all the dates, but I think okay. 10, we released our study on preventing scar tissue, and that's going to be, we're working on another added paper to that. So there are things we can do there. And contraception, for example, let's just go back to that. So, one of the things people say about methods like Creighton model or, whatever, if you're not on the birth control pill, people are going to tell you're going to become pregnant. And they'll always say, I remember as a resident, people tell me Creighton model doesn't work. People are going to become pregnant. Well, it's actually not true. And it's because people don't understand these methods. Creighton model is 96.8% effective at avoiding a pregnancy. If you look at the effectiveness for birth control pill, it's 91%. So it's better than the birth control pill. But people don't recognize that because they just see the pill as being easier and universal. And so I think the issue is, and you don't actually just have to look at what we've written about it. You can look at other people's research on the link between the birth control pill and breast cancer. Mm-hmm. All these other things. There's a lot of research out there, but you have to dig for it because they don't widely publicize it because they don't really want to, right. Because that kind of goes against the whole mantra of birth control for everybody, especially our young teenage women. Well, the birth control risk or the breast cancer risk actually goes up the younger you are when you're put on birth control. So I believe it's if you're less than 20, the risk goes up. There are different risk factors for that. But so there's actually a lot of research out there. Ours is concentrated in, one of our textbooks. If they ever needed specific things, we can always get that to people. They can always, one of our emails is, oh, great, I'm probably going to get it wrong. I think it's naproquestions@popepaulvi.com, and we can answer questions through there too. But if people are looking for a specific topic or, research, we can help them with that. But we do have a lot of research in this area. We need to continue to do more research, though.
Yeah, and we need more people in this field. So those young listeners that are listening, ladies, do it.
Absolutely.
Yeah, I met a girl who is studying. She's still in school, but she's looking to do OBGYN, and she was saying, I did an episode talking about like the paper sheet and just like how I'm like, this is a horrible experience. And I was like, someone needs to combine your OB visit with a spa. Like in the waiting room, you're getting like a pedicure, like turn it into like a big, beautiful thing. And she's like, I'm going to try to figure that out. I'm like, good, that'd be awesome. Like real sheets, not paper sheets. And
I know. I always tell people no one likes going to the gynecologist.
I know, right?
No, it's true, but we need good OBGYNs.
Yes.
We need good Catholic OBGYNs. I think for so long, people have been afraid to become if they're Catholic, for example, an obstetrician gynecologist, because of the whole birth control and abortion issue. But you know what? I feel every day that I do this, I have not prescribed birth control ever. And I have not regretted it. I've never felt that I've needed it because I think that the treatments are subpar. I don't think it actually helps these women. So a lot of times I would get told, well, you're going to need to use birth control, or there might be a time where you're going to need it to treat somebody. I've never needed it.
No.
And why? Because I think our treatments are better. I think what we're doing for these women is actually better. And so, everyone talks about, you Catholics don't like birth control. It's just an ethical thing. But what about for medical reasons? Well, I think we have, as a physician, I have two responsibilities to my patient. I do need to make sure that's an ethical treatment. That is a big responsibility. I also have to make sure it's a good treatment. Right. And when I look at hormonal contraception, my first thought is this is not an ethical treatment. The second thought, though, is it's actually not good medicine.
No.
And so how can I, in good conscience, then tell my patient that I'm going to put you on birth control for that? Because I don't believe it to be good medicine. I believe we have better treatments out there. And so, in Catholicism, technically you can prescribe birth control pills or hormonal contraception for medical purposes.
But as you just said, there's no need. It's like actually
right.
what you be getting from that, I can get you in something that's
Right.
compounded or through this hormone or that. Yeah.
Right. And I think the beautiful thing is the only reason we have NAPRO technology is because of the Catholic Church's teachings, because the Catholic Church stood strong on its teaching on contraception and abortion. And because there were people like my father, for example, who decided that this was right and they needed to figure out medicine to be in line with that.
Yes.
And only because of things like Humanae Vitae and these teachings of the church did we decide we need to look at these things differently. If the church did not stay strong, then we would probably be prescribing contraception as well, because the entire world tells us this is what we need to do. So why would we be challenged to look at something different? I think the only reason we would have eventually gotten to this point is because we would have been dissatisfied with the results of birth control and these other treatments that we have. But that would have taken us longer to get to this point. But because the church stood strong and we wanted to be faithful Catholics and treat our patients with dignity and the respect that they deserve, that's why we got to the point where we were.
Good holy doctors stood up, like you and your dad. And thank you so much. I really feel like I don't know either of you. I've never met you. Your dad doesn't know that I exist. But like without like what he's done and without Creighton, like Matt and I, like we wouldn't have our kids. Yeah. Like we are so thankful for these 4 souls, and they're amazing people that are going to rule the world one day. You know, and I would love to see, for him to be able to see the trickle down effect of all the people that exist, and then all the women that have not died that would have if he didn't come up. You know what I mean? Like it's brilliant. Like I'm so thankful. And yes, I'm so thankful to the church and her teachings and the wisdom that she has. And
absolutely. Yeah, it always irritates me that when people say, oh, you know, the church hates women. It's so anti-women. I'm like, are you kidding me? The church is one place that's actually standing up for women. Yeah. But it's in a way that people don't recognize it. But when you have to stop and think about it and read about it. But when you do, you realize that the church is a protector of women.
Yes, exactly.
And that is beautiful. And we don't give the church enough credit for that, I think.
No. And I think showing exactly what you guys do at the Pope Paul VI Institute, looking at what you do, it's like, okay, that is so pro-women. You know, it is so pro-woman. And then you look at the Super Bowl halftime show and you're like, that is anti-woman. Can we all say that is, okay, the only people that are like, yay, are like the go-hung liberals that are like, freedom, and then the perverted old men cheering them on. I'm like, ladies, that is not really
right. Absolutely. And why does that get applauded? Because we've separated the female body from her soul and her mind and her heart. And how did we do that? We did that through contraception and abortion and the sexual culture. We need to put the two of them back together and learn how to respect women for who they are as a person. You know, in this day and age, we keep demanding for respect. I don't know how that's going to happen when we continue to promote these contraception and abortion, because that is underlying, basically telling the underlying issue is that a woman's body is meant to be used. Right. And I don't know how you can get past that until you change that mindset. And it won't be changed if we continue to blast hormonal contraception, abortion, as reproductive justice for women, because it's not. No, it's actually a lie.
Yeah, it's a lie, and it's not pro-woman. And my husband speaks a lot on pornography, and Matt always says, like we've had very interesting friends. So we have a guy that used to like produce for Playboy. We have a girl that used to be, in the porn industry. And when they're off camera telling you what they went through and what they've gone through, just so they're doing these drugs just so they can do these scenes, but they're so objectified and they're so mistreated. And I feel like science has finally caught up. So like Matt started talking on pornography, like, I don't know, early on in our marriage. So probably, I don't know, at least 15, 20 years ago, he started doing these talks, and no one wanted it. Like when he worked at Catholic Answers, he had all these talks, and people were like, oh, can you just do a chastity talk like Jason? Yeah. Why do you want to talk on porn? But now that's all people, I mean, he does, other stuff, but that people want this. And he has this book that with Ignatius, and it's a non-religious response to the pornography. But what I find so fascinating about it is it's all neuroscientists, and like half the book is like cited stuff, and it's like science is on our side. And I think what you guys are doing doing there is so good because it's like, okay, no, we're looking at the human body. Like we're not like, yes, it does. If you read, Humana Vitae and the theology of the body, yes, it is with all of this as well. But also if you just look at the basics of the body and the way it's made and the way it's meant to work. What do you wish people knew about IVF? Because I think that's another reason people are like, oh, you're anti-woman. Like, why don't you want her to get pregnant?
Right. Okay. Oh, that would be a whole few more hours of talking about IVF.
I know.
This is what I think about IVF. IVF is being touted as the way for women to become pregnant if they can't any other way. And it's a lie.
Mm-hmm.
IVF has major issues. It's not a very good treatment. The highest success rates with IVF are going to be in young women, like the ages in 25, for example. Those success rates dramatically decrease the older you get. Who are the women who tend to get to IVF? They're the older infertile women. Mm-hmm. Okay, so that's one issue. So the success rates with NAPRO technology and fertility are actually higher than that with IVF. And why is that? It's because we actually figure out what's causing the infertility and we try to remove those roadblocks. Infertility is a symptom of something else. It's a way for the body to tell us, I should not become pregnant now. Why? Because if I become pregnant, I'm going to miscarry. Mm-hmm. Or there is a physical roadblock to me becoming pregnant. I cannot become pregnant. That's what infertility tells me. It's a symptom. It's not a disease. Okay. Mm-hmm. IVF just treats a symptom. So you're infertile. I'm going to create a baby by taking a sperm and egg. I'm going to put in your body. Now your body it's sick. Because infertility is a symptom of an illness, and that illness might be poor hormones or endometriosis or something like that. So it's going to force a pregnancy on these women who shouldn't become pregnant because there's something else going on that they haven't figured. And what happens is these women have higher rates when they do become pregnant, premature labor and delivery, other things that, other consequences to their pregnancies. So they don't end up with healthier pregnancies. The other issue is the ethical issues. IVF is actually highly abortifacient because they have to make so many babies just to get one or two. And I think a lot of people don't realize the high abortion rates in IVF. I think they just view it as you deserve to have a baby. Here's a way to have a baby. But they don't think about all the other babies who get killed or all the babies who are frozen for years and years and years. There was, I remember I was organizing my father's library when I was a college student. It was my summer job, and it's an intense library. And it was,
I'm sure it is.
It was journals everywhere, and it actually took 2 summers to do. But one of them, one of the small journals, I would flip through it, and there was always an advertisement, have a storage problem, and what it was referring to was embryos. And it was basically advertising freezer and storage. But that's how they phrase it. Do you have a storage problem? Wow. And that was their byline, their catch to get people to look at their ad. And that kind of struck me as very cold, and no pun intended, because it's freezers. But I don't think people realize the ethical issues with IVF. I don't think they realize that it's not a good treatment. And why is it not a good treatment? Because with these women were never evaluated properly in the first place. Right. They never had their issues of completely adequately diagnosed and then treated. We have women who come to us who have failed IVF, and they get pregnant with us because we figured it out. Now,
well, and that's amazing. So I know people will say, okay, Cameron, that's fine for you to say that you're against IVF because you have kids. And it's like, I could have been one of those women. I probably would have had I not a practicing Catholic and, upholding all the church teachings, but I went a different route, and I was able to get pregnant thanks to the gift of this technology. And, and I know Dr. Phil Boyle in Ireland had tons of patients that would come to him, and he would only see married couples. So there was couples that were living together for many, many years trying to get pregnant, couldn't. And they're like, well, we might as well get married and then go see him. And then they were able to get pregnant,
Yeah, no, I think it's a mindset that we have that IVF is, everyone gets pregnant and goes through IVF, but they don't realize how expensive it is, the heartache, and how many women actually don't get pregnant with it. And I think it is sad that this is what's going on. So it always, a lot of states, or there's several states who are trying to pass, your insurance should cover IVF, or you should be mandated to get so many cycles covered. and it's not a good treatment. And yet people are trying to force it on us. But it's not a good treatment. It's actually not a treatment. And it creates a whole host of problems that we're going to have to figure out what to do. What do we do with all these frozen embryos? And the other thing, too, is I think it changes the way we view children.
Yes.
It creates a child that you bought. It creates a child. It's a product.
Yes.
And so if you're not entirely happy with that product,
you can get rid of it or return it.
Yep. Exactly. And I think that's one of the beautiful things about NaPro technology is we try to always remember that children are a gift. And actually, it's not really, we don't get to determine who becomes pregnant. That's actually ultimately God, right? Like he bestows that gift on us. But sometimes we need to kind of help the body out a little bit so that it can receive that gift. And for some reason, there are going to be there are those women and those couples out there who can't achieve a pregnancy, and we're trying to figure out why. There are those difficult cases out there. We're not 100% helping these couples achieve a pregnancy. Hopefully one day we'll have a cure for them, but these children are a gift and they're not meant to be bought. And I think we're going to have consequences down the road with IVF because of that, because the view of what a child is to the family is going to change as a product.
Yes. And I think you're right. I think we can have a whole nother episode on that. A couple more things I want to cover real quick.
Sure.
Even for our signal, I have a friend that called me up the other day and she was in tears crying, and she took her 13-year-old daughter to the OBGYN for she just has bad periods and she's in pain, and so she just took her to just a normal doctor, and basically she's in the waiting room. And so she has a large family. Her youngest is with her, who's 3. So she has this 3-year-old and then this teenage daughter, and they're like, okay, well, you can pick up your birth control pill. And she's just like in shock and awe. And she's like, wait, does she need this? Oh yes.
Right.
No, her symptoms are only going to get worse unless you act now, get her on the pill. And so kind of advice for that mom, I try to relocate her to a couple other doctors. But also like the young girls, so I lived in tampons when I was a teenager. Like I wasn't taught any other way. And that's all we were taught to use. And then at one point I switched, to pads and whatnot, but these menstrual cups. So I want to ask you about that young girl, and then also ask you about your thought on menstrual cups, or what is the best, most naturalist way, I guess, for you when you are on your period?
Yeah, I think that's a hard question. I actually don't have a preference with menstrual cup versus tampon versus pad, to be honest. I do wonder about what's in our tampon sometimes, and if that's creating problems, like kind of an irritation near the cervix and the vagina. I don't have any research necessarily to suggest that, but I have wondered that. I don't necessarily tell people to avoid them, except on their light days when they're charting. They shouldn't really be wearing them. You do have to properly use a tampon. I have a lot of women who use menstrual cups, and I think that's fine as well. And then pads. Every woman is a little different. And so I don't force one way or the other on them. And I think sometimes it depends on their jobs. Some women, it's harder for them to wear a pad. It might be easy, because they don't have the opportunity to change like a tampon or a pad as often. So maybe a menstrual cup is better, because a lot of times they can go a little bit longer with a menstrual cup. So I think it depends on a lot
of different factors for that woman.
I think so.
And I've definitely had to I've never done all of the above, because it was before menstrual cups, I think, came out. But I'd have to have like a super tampon in and a pad, and it was just one of those days,
Right. And a lot of women are going to menstrual cups. And I think if they feel comfortable with it and they like it, they should, that's okay to use them for right now, because I don't have evidence that shows me that one is necessarily better than the other.
Okay. Yeah. I am just from my own experience. I think that I definitely wore too many tampons and too big. And I think there was probably chemicals in them, and they weren't the best. And so I don't know if that added to my problems or, but I doubt it helped me.
Yeah. And I think tampons, I do think we have to be a little careful with them, because I think people don't actually always wear them appropriately. Maybe they have the wrong size. They wear them too long. They're using them like a larger size or a more absorbent size on a lighter day, and it can be irritating, And so I think I think it goes back to education.
Yes.
We need to educate our teenagers how to properly use tampons, pads, menstrual cups,
Well,
all that, and
yeah,
educate them on their body. So I think it goes back to education more than anything else.
have you guys ever gotten into that, into like educating schools? Like, have you ever like done a Senate?
Oh,
Like, you know how like Planned Parenthood
that's
does
one of
their
my
thing?
dreams.
I would love that. I would love for
Yeah.
y'all to have something like that where you teach girls how, like, what to use, how to use it, safe products, but then also teach them how to chart, just the
Yeah.
basics of charting, and let's figure out your health.
When we women chart crate model, they have to go to an introductory session, which kind of is a very general, explanation of how their body works. And one thing we would love to do is develop one geared towards the teenager, because we have a lot of teenagers who
Yes.
chart, but it's one of my dreams is to get to these women when they're younger, because it's not right that they're learning about their bodies in their 30s, and
No,
so
it's not. You're right.
and so we need more people, because that's the problem, time and resources. But that would be a beautiful thing to get to these women when they're teenagers and learning about their body. It's a perfect time. And it also teaches them how to respect their bodies, prepare themselves for marriage, not to necessarily sleep around with any guy, to
No.
respect
Well,
their body
and
as
that's it. It's
a
teaching them
beautiful
the
gift.
dignity of the body. And then I've also heard
Absolutely.
I know of a few different religious orders, sisters, nuns that use your Creighton model
Yeah.
NFP. And obviously they're not doing it for anything with their
Right.
fertility. They're doing it to just be overall healthy women and check
Right.
their, women's health
Right.
issues. So
Well, yeah, and like nuns, those beautiful sisters, I mean, they're going to have medical problems too. And sometimes, we've had sisters come to us, they've been put on the birth control pill by their doctors. Well, why? We need to figure out what's going on and help them. And that's why this charting system is not just meant for married women. The gynecological aspect of it, every woman should know how their body works. And it can be started in those young teenage years and then carried through into menopause. And then it's a beautiful system. Anyone can use it. They just have to learn how.
yeah, no, I plan on teaching my daughters. We're not there
Yeah.
yet, but once they
Yeah.
are, I plan on teaching them and getting them taught.
Yeah.
I had a lot of questions about pelvic floor pain as well.
Sure. Sure.
Could you talk to us a little more about that? And
Yeah. So pelvic floor, so there's a bunch of muscles in the pelvis, and pelvic floor pain can be the result of different things. So whenever somebody talks about pelvic floor pain, my first two thoughts are always endometriosis and maybe scar tissue. Then once that's evaluated and treated, if there's still persistent pain, I often talk to women about the musculoskeletal component of things. So for example, when you're sick, you kind of lay in the fetal position because it feels better to be kind of curled up in a ball. So when women have a disease within their pelvis, like endometriosis or pelvic adhesions, I think they subconsciously utilize their pelvis differently to try to protect themselves from pain. And then after it's adequately treated, they still have that pain because those muscles have been trained inappropriately to be used inappropriately. So we can send them to physical therapists to get that straightened out. There can be other causes of pelvic floor pain as well. For example, women who've had vaginal deliveries might have some prolapse in the vagina or things like that. But pelvic floor pain, to me, typically is a sign of something going on inside the pelvis itself, like endometriosis or scar tissue or cysts, ovarian cysts. So, I think they all kind of play a role together, and it depends exactly what their symptom is, but they need to be evaluated properly.
Nice. Okay. Yeah. And that's funny that you say that about the fetal position. Like that's how I just always sit.
Yeah.
Like I just almost always have my knees to my chest with my arms around my legs.
Yeah.
And I think it's once you said that, I was like, oh gosh, that's probably why I sit like that so often.
Yeah.
Is because the majority, the pain.
Yeah. Well, it's really interesting because there's so many things that go into it. For example, endometriosis and scar tissue cause considerable pain. So when we treat it, I always tell women, some women get 100% pain relief, but not everyone does. So my goal is in that 50 to 100% pain relief. But then, there are other things that affect it too, like the muscles, diet, because endometriosis is so inflammatory. So sometimes when women have an inflammatory diet, that exacerbates kind of an inflammatory condition that exists. So sometimes when women change their diet, their pain gets better after, the removal of endometriosis. Even if they have endo, their pain can be diminished a little bit with diet changes as well. It just doesn't treat the condition. But, so that whole, the bowels sit right around the uterus, fallopian tubes, and ovaries. And so they're right in the same area. And so it's amazing how all these systems start to play a role, the hormones and all that. It's very interconnected.
Yeah, it really is. I find it fascinating. And when I was in the hospital with my septic infection, I was in the hospital for about a month and they just couldn't figure out, what was wrong,
That's
whatever.
tough.
Yeah. But I was so constipated that and I was like, I think it may be my endometriosis. And they're like, endometriosis does not give you constipation. I'm like, okay, well, I'm just saying, and they tried all these different things. And then they eventually had to give me a barium enema. And the lady was like, I've given you more things. I'm a small built person. I naturally weigh like 120, maybe 130 pounds. And she's like, I've given you so much stuff. I'd clean out a 600-pound person. Like, what is wrong with you? And I'm like,
oh my
I know,
gosh.
I'm sorry. I'm really special like that.
Well, constipation causes a lot of pain. I'll tell you that.
That too. Yes.
That is a battle I face with many patients. If I could give Miralax to every woman who comes in my door, I would.
Right.
Especially when you're undergoing surgery but you can see bowel changes with women with endometriosis. It can be on the bowels, all that. So pelvic pain, we don't have all the answers to it either. But I think, again, it's because we don't know all the causes.
Right.
And part of that is because we're not looking into it because we give people birth control pills.
Right. Well, I know that I feel like there's more physios popping up that specialize in pelvic floor physios, which is great, or physical therapists.
Yep. Yeah, I utilize pelvic floor physical therapy frequently with my patients. Not everyone needs it, but those who I think do, we talk a lot about it. So absolutely, I think there's some benefit to it.
No, that's so good. I think it's just really good to be aware and talking about these things. And what else? So the younger you are, and I'm the same. I really think young women, I wish I could go back to me in high school and be like, here's what you need to do to figure out what's really wrong with you. And I think especially so getting young girls charting, what else do you wish you could tell like the young women now? Like, find a good doctor, obviously, but also, there are many different diseases and things. What would you say to them that are listening?
Well, if I'm just talking to a young teenager, for example, I want them to know you need to find a doctor you trust who's going to listen to you, who's not going to push you into birth control and all that. You need to learn how to chart your cycles. You need to learn how to respect yourself as a growing woman, right? Because I think if a young teenage girl can respect herself and figure out who she is, she's going to take care of her body in such a way very differently than somebody else. And she's going to learn about that body, and she's going to have better self-esteem and all that. For the maybe young married woman or the woman going through infertility, if you're experiencing infertility or frequent miscarriage, there's a high likelihood they have endometriosis or hormonal abnormalities or something along those lines. Endometriosis is it's difficult because women think you have to have a lot of pain to have endometriosis, and that's not the case. You can have a lot of endometriosis and very little pain. Sometimes the first symptom that appears for a woman where she's actually concerned is the fact that she can't get pregnant, or maybe she's had 2 or 3 miscarriages and they can't figure out why. Mm-hmm. And I've had patients they do have some discomfort, but it's not bad, nothing that you would really think about. And they have significant endometriosis, and it's a cause of their problems. You can have a ton of pain and just a little bit of endometriosis, but it's just in the right spot, just that aggravating factor. And so I think it's okay if you're having infertility or miscarriage to say no to IVF and intrauterine insemination, all these things, and pursue medical treatments that are in line with figuring out what's going on with your body and in line with your faith, because that's where you're going to get the answers. You're not going to get the answers elsewhere. And so I think being in tune with your body, just understanding how your body works, gets you set up down the road for when problems do occur. And not everyone's going to have problems, but let's face it, a lot of people do. And so I think that knowledge and that education is huge.
Yeah. And then I know that there are women now, I have a lot of, young adult women, both single and married and engaged, and they're talking about different things. I guess there's a growing number of apps now that they're like, oh, well, I don't need to do NFP because I have an app for that.
Right.
And
right.
I tell them, I'm like, there's no way your app can teach you what my instructor taught me.
That's actually correct. No, they did a study not too long ago that looked at apps, and they're not very effective. And I have girls come to me when I talk to them about charting. They're young, college students or whoever. I'm like, you need to start charting. Like, oh yeah, I have an app for that. I'm like, no, that doesn't look at the same thing I do. And the best methods are those who have a teacher that you have one-on-one contact with. And for NAPRO, we can only utilize Crate Model as our charting system. And the reason why, and a lot of people get confused by this, is because all the research, all the treatments and evaluations were based off the standardization of Crate Model. And that doesn't necessarily correlate to other apps or methods or things like that. So we have to be, that's why we use Crate Model for that. But I actually am a Crate Model practitioner. I don't teach as much now just because of my medical practice, but I cannot tell you how much gets talked about in those sessions. Yes. And what goes on, the learning. And I love teaching Crate Model. I sometimes, there are days I'd be like, man, I wish I didn't have to go to the clinic today. I could just teach people about how to chart in their bodies. And you get to know each other so well. And I love to see young women get excited about their bodies when they're there, talking to you. I love to see couples and the dawn of recognition and what's going on in their married lives, their wife's body, and their shared fertility. And it's just a beautiful thing. And so I think that we shortchange ourselves when we just try to get the app. Yes, it might be free or easier, but you miss out on the education and the true learning of how your body works, because you don't get that in an app.
No.
They just teach you, when's your period, or, different things, but you miss out on that. And I think having that teacher who has experience and has talked to multiple couples, it's a huge benefit, because you can ask them questions. You can get to the bottom of what's going on. And also, women's charts are more complicated these days, and you can't adequately address that through an app. So they're good for kind of knowing when your period has occurred. But if you really want to learn how to chart your cycle, you need to do it with a teacher. Absolutely.
Yeah. It's like a baby step. It's like, okay, well, that's neat. That was like your little education thing. But if you really want to know. And then I also think young girls I think that we have a growing number of 20-something-year-olds and 30-something-year-olds that want to be married, and they haven't met Mr. Right. And so they're not... And I think most of them think, like the ones that are good, faithful women are like, oh yes, and I plan on doing NFP when I get married. Yeah. What do you have to say to that girl now who's 30 and maybe does
start now,
right?
Okay, so I will tell you personally why. Okay, so I grew up in a family that helped develop this Crate Model, right? And I was a stubborn, I rebelled by not getting my issues treated. So, for example, I said I had premenstrual syndrome. And for me, it's not that, I don't think I'm an angry person. Everyone thinks it's that crazy, angry lady. She's got PMS. No,
snapping at people. Give me chocolate now or else.
Yes. No, but you can just feel very poorly. And I suffered with that for years. And it got worse in residency because of the stress I was under. And I remember the July following, I had graduated from residency in June, and I went to July, I went to Fatima with my mom and one of my brothers in Lourdes, and I just felt horrible, and I couldn't figure out why. And it was PMS. And I finally got evaluated and treated. And the first cycle I got treated, I felt so good. And I remember thinking, Teresa, you idiot. Right? You knew better. And, I just put it off because, I wasn't married or anything like that. I know how to chart and all that, but I just was putting off the evaluation and, all of that. And I wish I hadn't. I wish I had done that 10 years earlier, because I should have been feeling better a lot sooner. And so I think that's the thing, like, we need to take care of ourselves. And even if you're not married, charting is for you, because if there are issues, let's get on top of it now. Let's protect your fertility now before it's a problem when you do get married. And we do operate on girls who are not married because they're having pain, they're having issues. We treat them with hormones because they don't feel good. we deserve to be evaluated and treated as well. Even if we're not married or trying to have children, those women still deserve to feel good.
Yeah, I'm very thankful that I at least started charting prior to marriage to figure out some of my stuff. Because if I had not had that laparoscopy when I was single, I don't know. And then after Matt and I got married, I had another one shortly after we were married because we did want to have kids, and we did. Right. And I feel like it was I don't know, like. Yeah, I'm so thankful I did. But hindsight, I wish after, my second kid, I had found, I just, if I had lived in Nebraska, I would have come to y'all. Yeah. But I'm like, maybe it would have been worth me flying out for pregnancies or things that I'm like, I knew better kind of. And maybe that would have saved my last child, or just saved all the sickness I went through. I mean, I don't know. It's all hindsight, right?
It is. And I think that too. And I think for me, I just, my mom and dad would, they'd tell me you need to be evaluated, but I didn't want to listen to my parents,
Right. You're like, no, I'm fine.
No, it's not that bad. I'm really fine. And, I came up with 1,000 excuses, and I look back and I wish I hadn't created those excuses. I wish I had just done it. And I think that's important. Young women need their health taken care of to protect themselves and their fertility for down the road.
Yeah, no, I think it's great advice. And even, and it protects your fertility for later. So even though you may not know who that is. Right. And then one last question someone had asked, and I don't actually know the answer to this. I'm like, I want to say no, but I don't know. They said that they heard in the cases of, anyhow, the morning after pill, is that the same as RU46? What exactly is it? Because someone said that apparently it's okay with church teaching if you use it right after a rape.
I would say it's not okay.
Yeah, I would think so too. Explain to us the difference between RU46 and the morning after pill.
Yeah, I mean, I think, so there's actually multiple forms of emergency contraception. And so the whole idea is, so actually, if you read up on emergency contraception, it's not just like Plan B and things like that. There's different things. So like they'll use the copper IUD. There are different things they can use. And I think people don't know that. I think there's 3 or 5 things people can use. So they have different mechanisms. So the idea is what they're trying to do is prevent fertilization if somebody's ovulating at the time of a rape or implantation. First, rape is a horrible injustice to that woman that happened to. Right. It should never have happened in the first place. But I think the next injustice, if she does conceive that baby, is then targeting that baby.
Yeah. Then it's 2 great injustices that have been done.
Exactly. That does not mean that woman has to keep that baby after giving birth to that child. Adoption becomes a beautiful gift. But I think what we don't realize, because we think that, again, I think it's our mindset about children. It's a product meant to be bought. And so if it's forced on you when you don't want it, then it's a problem. And so they view it as a reminder of something terrible that happened to a woman, like rape. But what we don't realize is that these children are a beautiful gift. And maybe that child is going to bring some good into that woman's life, and help heal her. And maybe she'll keep that child, or maybe she'll give that baby up for adoption and give that gift to somebody else. And that's, I think, a huge healing process for these women. Instead of hitting her twice while she's down with rape, and then, we're going to do everything we can to keep you from getting pregnant, whether that's with an abortifacient or emergency contraception or an abortion. If she does become pregnant, we're just knocking her twice. And that's not right. And I think we have more to do about that. We need to reduce the rapes in the country. And I think part of that is by changing how we view the relationships between a man and a woman. And, the fact that this is not an object meant to satisfy your sexual pleasure. I mean, rapes have occurred throughout the beginning of time, honestly, and we'll never completely eliminate them. But I don't understand why we then attack the woman again with emergency contraception and that child that could potentially be created. So I think there's a lot of issues with it.
No,
And so go ahead.
No. You're completely right. I totally agree with you. I just, I think it comes down to the dignity of the human person, right? And we want to
Right.
help her where she is, right? And as you
Absolutely.
said, that baby can be a gift to someone else. For all of our listeners that are Catholic that are like, okay, I believe the church's teaching on contraception, and it's hard to talk about even with other Catholics who are maybe not so practicing. They're like, oh yeah,
Right.
like I was raised thinking the church had changed their mind on it. Like, and I'm like,
Right.
what? Why would we think that? But and yeah, even where I lived in Ireland, like they were told, and they told me, they're like, oh no, nobody really believes that anymore. No, it's the old
Right.
priest that says that. And I'm like, oh
Right.
well, we're both early 20s and we just got married, and we actually believe it, and it's
Yeah.
amazing and beautiful to
Yeah.
save sex till marriage. And
Right.
but what's your advice to them for talking to either friends that like really don't believe the fullness of the faith, or non-religious friends when they say things like, like you're crazy, not even necessarily judging them for being crazy, for having too many kids or being open to life, but rather
Right.
how can they educate these other women for how to do what's best for their body?
Well, I think it's tough. I mean, it's not the easiest thing to talk about because there's so many misconceptions about it. So I think the first thing that people need to do is they actually need to understand the church's teaching. I think so many of us don't actually have a good understanding of it. And I think that's just representative of the failure of, the church to educate us on it. We don't get good education on these matters, contraception, the dignity of the person, the dignity of marriage, all that. And so you almost have to look for it you have to be almost self-taught on it. So I think the first thing is we actually need our priests to help educate us. And then, good, faithful Catholics need to understand the church and the teaching, how beautiful the teachings of the church and how beautiful it is. And then I think the next thing is you just slowly open the door. You don't pound it onto people. I think you get to understand why they believe what they believe, why they think maybe contraception is okay, what their anxieties or fears are, because I believe that a lot of women turn towards contraception, sterilization, and abortion because of anxiety and fear. The fear of, I don't know if I can have another child. I don't know if my husband's going to leave me, or I don't know if financially we can do it. It's all fear driven. So how can we actually support these people in the decision to maybe get away from contraception? And then I think the other thing is living a joyful, beautiful life and being open about the fact that, for example, people know I'm not on the birth control pill. Some of my friends who are physicians, I was telling them about some of my issues, and they're like, why aren't you just on an IUD? And I'm like, I'm not putting that inside of me, and they know that. And so if I can live joyfully and be just a witness of the church's beauty, I think that speaks volumes too. And I think it's okay to say, I believe the church's teachings and actually support the church, and say, when somebody says, oh, the church is old fashioned, or, all the arguments we've heard, I think it's okay just to say, I agree with the church, and you don't necessarily have to get in a huge argument with them. You have to love them where they're at, because a lot of the time it's because they don't understand the church's teaching, or they're afraid. And so they're afraid that, we're going to come down hard on them. But if you love these people and know that their understanding may not be where it needs to be, then you can open up doors with conversations and all that. But first, we have to know what we're talking about too.
Yeah.
So
And I think that's part of
thing.
the beauty of NAPRO technology, because we can love them, because people are like, well, you can't tell someone not to do IVF because that's just mean.
Right.
And it's like, no. Actually, I'm going to love them and tell them a better way so they can actually fix their body and make it healthy, and then let them actually achieve more naturally.
Absolutely. And I think that's the thing, truth, it's all about truth and compassion, right? You have to, it's not compassionate to lie to them and say, oh yeah, IVF's fine, or contraception's fine, or abortion's fine. No, because we're hurting these people in the long run. You have to love them and give them the truth, but it's all about truth and compassion together. That's what we really need to do. And if we take one away from the other, it's not going to work, but we have to love them where they're at, and we have to just keep talking to them, keep educating. And we're just planting seeds. I think the other thing too is, we're not saviors. We're just little workers on this earth, right? We're not going to change everybody, but we just have to live a faithful, joyful life and plant seeds for people. And I think that's where it's at.
Yeah. And you are so beautiful. Thank you so much. Like I, even just this hour that we got to spend chatting, I love you. And I'm like, thank you for what you're doing. And you're so beautiful.
Thank you for what you're doing.
No, I just think that you convey it with such passion and such hope and joy. And as you're saying, do it with love. It's like, well, you ooze love. Like you ooze like the dignity of you ooze the feminine genius, and I love it, and it's beautiful. And I love that you could do it just in a conversation like this, but I know you definitely do it in your work. So thank you. I'm so thankful. And I think it's really important to have your dad's amazing, and I'm so thankful for him and your brother and everyone else that works for NAPRO. But I love having a woman too. Like I feel like, okay, you do it with our feminine heart, which is just different and so good and so needed.
Yeah. Well, we have to help each other out. And I think we put ourselves on an island too much. And we need to love each other. We need to be there for each other. And sometimes that means I don't have the answer for you right now, but let's try to figure it out.
Yes.
And I think we're so used to getting the answer right away. And we just have to love people and be witnesses, and we have to speak the truth. And, I tell my patients all the time, we just have to figure out what's going on. And we may not come up with the answer completely because there's so much we don't know, but we just have to love our patients, and it's an honor to take care of our patients. I think it's a beautiful gift we've been given to be Catholics, and the gift of our Savior and all that. And so we just have to love each other, show that to them that we love them, and the truth means something. And I think we'll go far.
Right. Amen. Amen. So if people have more questions, we're pointing them all to the Pope Paul the Sixth PopePaul6.com, right? That's your website?
Yeah, I think it's St. Paul the Sixth now.
Oh, okay.
He got canonized. And so if they have questions.
What's funny? Your address is still PopePaul6.com, but on the website it says St. Paul the Sixth Institute.
That's probably right. Well, we just changed our name in May, and so we're slowly changing everything. And it's so fun because there's so many things we have to change, and you don't realize it till you start changing all the names on all the forms and everything. So we'll get there eventually.
No, but there is. Congratulations. It is St. Paul. That's so fun.
It is. But it's PopePaulVI.com. And we're happy to answer any questions, and we're just here for people, so that's what we want to do.
Which is so beautiful. Thank you. And thank you for all the classes that you offer and training other doctors. Because I know that's so much of the issue is like, okay, but do you have anyone like closer to me so I don't need to fly when I'm pregnant or whenever? So.
Exactly. And thank you so much for you do. And thank you for having me here today. It was a real joy for me. So thank you so very, very much.
Okay, how much do I wish I could go back to 15, 16-year-old me and play this episode for me? If you have a teenage daughter, talk to her about this stuff. Listen to this episode together. Like, I wish that when I was younger and I started, showing problems and having these issues, I wish my parents had known about the beauty of NAPRO technology and they could have gotten me plugged in. I think that I would have been a lot healthier and suffered a lot less with my overall health, let alone my feminine health in areas. And I mean, those of you that normally listen, like I've been there. I was diagnosed with stage 4 endometriosis when I was still a teenager. I think I was 19, and PCOS as well. And I had complications on my period. Like it was more like I got physically sick when I was a teenager. And I wish that I'm so thankful for Creighton, and I'm so thankful that I do have the children that I have. But I wish I could have even flown to Omaha and seen Dr. Hilgers. She was just so wonderful and beautiful. So don't suffer silently. It is good to suffer and offer things up, yes, but also go get the help you need. I'm in the process of actually sending her my medical records, and I'm thinking about perhaps flying out to Pope Paul the Sixth Institute and just getting my women's health under control. And I feel like I I'm an activist on this, and I've shared openly about my struggles, and just please share this with friends. Even if you have friends that they're not Catholic, they don't agree with church teachings. If they're a woman and they have a uterus, send them this episode. Let them listen, okay? If you have someone that you love and they're thinking about in vitro because they so desperately want a child, let them listen to this episode first, because they may end up paying a heck of a lot of money and going through this procedure and creating all sorts of new life, but her body is not able to carry the babies to term. It is more loving for you to say, I think you should listen to this episode prior to. If you are that person and you're seeing a fertility specialist right now, give Dr.Hilgers a chance. Give them a chance. Go there and get your body healthy and then get pregnant with that baby. They can help you do it the natural way, you and your husband together. So I really think that this episode is going to help so many, and it's something that we do need to talk about. So as I said in the beginning, please share this. You guys are my advertisers, so share this with other people. Thank you so much for making this episode happen, and thank you for your support. Follow us on Instagram, Facebook, social media, Among the Lilies. You can find all the links on any one of those sites. So thank you so much. Have a good day.